Hi, my name is Chelsea. Today we'll be discussing the diseases, symptoms, and treatments that are available. Bronchogenic carcinoma. The word root broncho means bronchus. Suffix genic means originating, producing, or causing. Carcin, meaning cancer. Oma, the suffix, means tumor or swelling. Put it all together, originating in the bronchus, a cancerous tumor. The anatomy that's affected is the nose, pharynx, larynx, trachea, bronchi, and the lungs. The pathology and the effects. The bronchus separates into the lungs and begins in the epithelial cells. A neoplasm, the tumor, grows into the bronchial lumen or the wall. Eventually, it spreads to the lymph nodes or distal organs if left untreated. This is a type of lung cancer. The diagnosis, treatment, and specialist. The specialist is an oncologist. The word root onc means tumor or mass. Logist means one who studies and treats, a specialist or a physician. Putting that together, physician who specializes in the study and the treatment of tumors. Diagnosis consists of a biopsy with a bronchoscope, imaging testing, electromagnetic radiation or X-rays, computed tomography, a CT scan, a magnetic resonance imaging, MRI, positron emission tomography, a PET scan, or bone scans. Surgical resections and treatments available are radiotherapy, chemotherapy, laser therapy, general management, including pain relief, diet, anxiety, and depression management. The next disease we will discuss is nephrolithiasis. Nephro, the combining form, means kidney. Lith means stone. Iasis means condition. Put it together, condition of the stones in the kidney. The anatomy that is affected is the urinary system, the kidneys, the bladder, and the uterus. The pathology and specialist. The pathology of the disease is there are hard deposits that are made of minerals and salts from inside the kidneys. Can be caused from supersaturation of urine, where your pH balance and your solute excretions, where the minerals and salts crystallize and clump together, and it's more common in men and obese individuals. Specialists include a nephrologist, the combining form nephro, as we discussed earlier, is kidneys. An ologist is one who studies and treats specialists or physicians. Putting it together is physicians who specialize in the study and treatment of diseases of the kidneys. Also, a urologist. Uro, the combining form, means urinary tract, and logist means one who studies and treats, a specialist or a physician. So physicians who study and treat the disease of the urinary tract. Testing options that are available is a nephrolithotripsy, which is a surgical crushing of kidney stones, blood and urine test, extracorporeal shockwave lithotripsy, which is used to fragment stones to be easily passed, precutaneous nephrolithotomy, which is used to remove stones that did not respond to the extracorporeal shockwave lithotripsy, and a computed tomography, which allows physicians to take a picture of a slice of the kidneys to see what's inside. Renal ultrasounds are used to create a picture of the internal organs. Also, urethroscopy, which is used to retrieve very large and complicated stones. And lastly, conventional radiography. Symptoms and treatments. Symptoms include excessive and sharp back pains, painful urination, blood in the urine, nausea, and vomiting. Treatments often include lots of water and medications to ease the stone passing, used by one of the previous treatments we discussed where they crush the stones, and it's left for them to come out. So that includes urinary retention medicine, narcotics, anti-inflammatory drugs, and diuretics. Next is prostate cancer, which is found in the prostate, commonly diagnosed in men. 95% are adenocarcinomas, which arise in the epithelial cell. So, the combining form adeno means glands. Carcin means cancer, and oma means tumor. Putting together, cancerous tumor of glandular tissue. The specialists that are included are urologist and oncologist. Urologist, as we discussed earlier, are physicians who specialize in the studies and the disease and treatment of the urinary tract. Oncologists are physicians who specialize in study and treatment of tumors. The diagnosis is often done through digital rectal exams, prostate-specific antigens, transrectal ultrasound, transrectal ultrasonically guided by biopsies, MRIs, ultrasound fusion biopsy, or MRIs with endorectal surface coils, which is used to determine the stage of prostate cancer, as well as multi-parametric MRIs. Treatments pending the stage of cancer and the age of the patient. Radical prostatectomy, which is performed either laparoscopically or with robot-assisted devices to remove parts of the prostate. Radiation therapy is also used with radical prostatectomy, which allows for radiation beams to target the prostate to kill the cancer cells. Hormonal therapy, which reduces testosterone, production, will slow the growth of the prostate cancer. Chemotherapy in active surveillance is also options. The next we will discuss is the vulvovaginitis. Vulva, the combining form, meaning vulva. The word root vagin, meaning vagina. And itis, which means inflammation, of the vulva and vagina. The anatomy that is affected is the vulva and the vagina. Symptoms often include aches, vaginal discharge, discomfort, and dryness. The pathology often includes, there's a couple different types that can cause inflammation. The Candida albicans, which is a bacteria in the vagina that can increase and cause yeast infections, which often end up with a very uncomfortable cottage cheese discharge texture. Bacteria vaginosis, which is when unhealthy bacteria grows inside and causes a fishy odor and gray discharge. Trichomoniasis, which is spread from sexual contact, includes itching, odor, yellow, green, gray discharge, and sometimes an HPV. Diagnosis and specialist. Specialists include a gynecologist. Gynec is the combining form, meaning woman, female reproductive system. And logist, which is physician who studies and treats. Putting together, physician who specializes and treats disease of the female reproductive system. Diagnosis can be completed through samples of vaginal discharge for a microscopic evaluation, as well as pelvic exams, wet preps, and biopsies. Treatments are often invasive and require suppressive therapy for recurrent problems, but more commonly oral treatment, topical treatment, and suppositories. The last disease that we will discuss is a myocardial infarction. Myo, combining form, meaning muscle, cardi, meaning heart, and all, meaning pertaining to the muscle of the heart, aka a heart attack. This occurs when a death of a portion of the myocardium is caused, usually through a lack of oxygen resulted from an interrupted blood supply. And this affects the cardiovascular system, the heart, the lungs, and the arteries. Specialists and pathology. Specialists include the cardiologist, cardi, meaning the heart, the cardiovascular system, logist, meaning who studies and treats the disease. So, physician who treats and studies the disease of the cardiovascular system. The pathology is either from a sudden blockage and a coronary effect and has a coronary effect on the body. Arteries formed a blood clot or thrombus, are narrowed by atherosclerosis, which is fatty deposits, which is a picture of below, fatty deposits building up throughout the arteries. Diagnosis is confirmed through electrocardiograms, which are records of the electrical activity of the heart. Physical examinations of the heart and the blood pressure, blood test for serum, cardiac markers, which release chemicals when the muscles are damaged within the heart, echocardiograms, which are records of the structure and the function of the heart, and radionuclide imaging, which uses radioactive isotopes to detect areas of poor blood flow within the heart. Treatments often include supportive care, defibrillation, which restores the heart to a normal rhythm, oxygen therapy, which provides extra oxygen to the lungs, and medications, including blood thinners to prevent blood clots and to assist in dissolving the clots, narcotics, which relieve pain, beta blockers, which slow the heart rate and decrease the blood pressure. Statin decreases the liver production from cholesterol, and ACE inhibitors relaxes the blood vessels, lowers the blood pressure, and prevents diabetes-related kidneys. Procedures include coronary stents, which are tubes that are placed within the arteries of the heart to keep them open, coronary angioplasty, which unblocks arteries by inflating a balloon inside of it and sometimes leaving a stent when they pull the balloon out. That allows for the clot that may have been forming to dissolve. Surgery, including coronary artery bypass surgery, which restores the blood flow to the heart by using a healthy artery to bypass one that's blocked. And therapy, including cardiac rehabilitation, which includes exercise, lifestyle changes, education on both exercise and lifestyle changes, as well as emotional support that can be expected coming through such large life-changing experiences, as well as for the family involved. Here are my references that were used for all pictures and information gathered. I hope you've enjoyed my presentation and that it has been fruitful. Have a great evening.